Our next speaker is none other than Dr. Krishna Prasad Kutlu sir. He'll be he is giving us, enlightening us on the topic of optical biometry, buying the ideal one and putting it to best use. Dr. Krishna Prasad sir is the medical director of Prasad Netralaya Group of Hospitals in Udupi. He is organizing chairman, Karnataka State Ophthalmic. He was the organized chairman for the Karnataka Ophthalmic Conference, and he is the honorary secretary of Karnataka Ophthalmic Society.
Thank you, sir. Thank you, Dr. Shaji, for including me such a wonderful course. So I'll be talking about the optical biometry, which is the best to buy. I don't have any financial interest regarding any of these products. So coming to the introduction, the biometry is nothing but the measurement of ocular parameters giving rise to ideal intraocular lens power measurement. So if you make mistakes, for example, if you make around 1 mm of axial length mistake when you are doing with the ultrasound biometry, always there is a difference of around 2.7 diopters. And if you make a mistake even with 1 mm of ACD, that means almost like a 1.5 diopters of IOL power difference will be there. So you have to be very careful when you are doing with the conventional ultrasound biometry, especially when you are putting the probe on the cornea, you cannot press also. So this has become like, if you see a lot of studies, most of the claims regarding the biometric errors only. So now all this problem has been eliminated by the optical biometer because of its high repeatability and reproducibility. And also very easy to do, and it gives a faster accurate reading. So these are the different biometers available in the market. You are having IOL Master 500, 700. Alcon has come up with something called Argos, and there is one more biometry, Tomy, which is quite popular in the market. So coming to the IOL Master 500, basically it works on the partial coherence interferometry. Simplest of the devices and good penetration only in early nuclear sclerosis, around 93%. It takes around 60 seconds for both the measurement, but the problem what we noticed, patient with a slight PSC or even with a mature cataract, it's impossible to do with this. Then we have, along with that, Lenstar also was there introduced by the Hackstick company, but this works on the low coherence reflectometry based on the SDOCT technology. Compared to the IOL Master 500, only the scanning rate is slightly slower. But compared to other OCDs, the penetration is slightly poor. But the one advantage, it can be even integrated with the other Hackstick devices. So coming to the IOL Master 700, which is based on the sweat source OCT, good penetration even in the denser cataract, almost 99%. And for both it takes around 45 seconds to measure. The most important advantage with this 700 is total keratometry. It also gives a Barrett True K formula for even post-LASIK patient. I think Chitra madam is going to talk about that. So this is what I am just mentioning about. If your patient is having a white intumescent cataract, if they want to go for a premium surgery, still IOL Master 700 can take out. And also it even measures about the lens thickness also. So along with that, the other features are, it takes about a central corneal topography that helps in deciding the IOL also, and also it measures from like a cornea to retina scan, that imaging technology. It also, very importantly, it detects the decentration and even tilt of the crystalline lens, and even post-operatively intraocular lens also. These are the other advantage. Actually, it visually verifies the evaluation by correlating the measurement of calipers with the image of anatomical structures that eliminates the complex interpretation of a scan and reduces the potential source of error. So the overall length it measures. So basically it works on 7 parameters. That is, it looks at the axial length, it looks at the corneal radius, and looks at the antechamber depth, and angle kappa. This is very, very important. What they say that it is like a Chang wearing cord, the measurement what they say like that. And also it works on the lens thickness, central corneal thickness, and white to white. So what, just the previous discussion, even angle kappa more than 0.6, they say that the chances of glare and halos are more with the multifocal intraocular lens. That is especially diffractive lenses. These are the other advantages. Always you should, few refractive surprise, especially you should look for always a good foveal pit and good fixation. This is a few example. If you see that this is the exact good fixation and good foil pit. When you see like this, see there is, if you see the measurement 1 and measurement 2, there is only 10 micron difference. That means this is the proper measurement. But if you see like this, and also when you look at the keratometry, there is not much difference in the measurement 1 and measurement 2. That is means only 0.02 diopter difference in the both the keratometry. That means you should look at both the measurement, that there should not be any difference. Suppose for example, if you see like this, there is a poor fixation. Because you cannot see the foveal pit. Then if you see there is more than measurement 1 to measurement 2, you can see more than 190 micron difference. That means you have done your second measurement is not good. And also you should look for even keratometry difference of more than 0.5 diopter. That means you need to repeat the reading. Otherwise you may land with the difference in the IOL power. And also you should look at the both the eye if there is a difference in the IOL power also. So also especially the other advantage, it also help in look at the macula also, especially patients with BRVO, so that you can refer them to the retina. And it can also take into all the 4 formulas like Holiday 1, Hoffer Q, SRKT, Haigis, Holiday 2 and Barrett 4. So all 4 generation formulas are also it can take out. So nowadays even with the newer model, I think you need not have to bother about go into their calculator. With the IOL Master 700 printout only you can take out the where exactly you have to put the lens. But as I said that it's a source biometry. You may have sometimes refractive surprise and optical. There is 1 minute time is there, no? Okay, I'll just finish. So apart from that, it can even helpful, especially there are a lot of centers including mine that it can incorporate into the Callisto also. Coming to the Tommy, that also works on the SSOCT 3D tracking system. Placido disk topography has been incorporated. Good penetration even compared to the IOL Master 700, and it takes just 45 seconds for both the measurement. You can see in the picture, so fast it is. Then coming, these are the advantage even with the Morgan cataract also, the study shows that Tommy OA 2000 can take the readings. So coming to the Argos, which is the recent one, which is similar to the IOL Master 700, but they say that it is faster than the all other biometers in the market. So it also takes angle to angle and cornea to retina OCT images, and it has got a toric IOL calculator, and it can be also integrated into a digital microscope Aura and this one. So I will not talk about Lenstar. So the one more biometer I just want to tell about the Anterion, which has got including topography and everything. So in the end I just want to tell what to buy. So if you want cost effective good toric calculator, Tommy holds good because of the price factor. If you want a gold standard biometry integration with the markerless toric element, go for IOL Master 700, that is the best. Then still if you want to go for higher end biometer with the serial documentation in astigmatism, I think Argos gives the best result. Then probably if you need a good biometer with the multimodal imaging functions like topography and all other features, then Anterion gives the good result. So choose the biometer on the basis of the requirement and available of the cost of the investment. Higher end machine for future purpose like markerless toric alignment system. Consider after sales service also very, very important. Presence or absence of other investigation like KSOS2023 or Biometry you need to look at, and consider return of investment based on your consultation fee and particular investment. Once again I thank my brother Saji and the whole team of KS for this opportunity. Thank you and all.
Thank you, sir. Wonderful talk as usual. Any doubts to Dr. Krishna Prasad, sir, on the biometry evaluation? Okay, sir.
Thank
you, sir.